Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Data from poison centers across the United States shows a troubling increase in exposure to medications, dietary supplements, and psychoactive substances among children, and those exposures seem to be tied to self-harm or suicidal intent. Here to talk about data for Upstate New York is Dr. Vincent Calleo. He's an adult and pediatric emergency physician and division chief for medical toxicology at Upstate, and he's the medical director of the Upstate New York Poison Center. Welcome back to The Informed Patient, Dr. Calleo.
Thanks, Amber. It's great to be here with you. Thanks for having me.
Now, this increase was noted in national data from the year 2000 to 2023, during which time the exposure rate associated with suspected self-harm or suicidal intent increased by more than 300%. What did you see for Upstate New York during that same time frame?
During that period of time, there has been a large increase in our data for intentional self-harm with children and adolescents over a few different age ranges. So I did break things down for our data and looked from the year 2000 through 2024. And what we found is there has been a pretty large increase in terms of the overall number of cases of self-harm intent. When we think about things for children ages 6 to 12, it looks like we had about 10 calls for that during the year 2000. And jumping forward to 2024, that number's increased to 137. So as you can tell, it's a pretty big increase over about a 24-year period. One thing that we found that's a little bit confounding with this data is that there has been a unification of some different poison centers from 2000 to 2024 in the New York region, where there used to be more poison centers and our center covered a different region that was smaller. We do cover a much bigger region now. So it's hard to know exactly what that large increase is from. Is it because there truly are that many more cases, or is it because there were more cases before that our center just didn't have because we didn't cover as many areas within New York? But that being said, regardless of if there's part of that coming from the unification or the combining of poison centers, it's still a pretty large increase over a relatively short period. And for children ages 13 to 19, we found in 2000, we had about 440 calls for children in that age range who were attempting self-harm. And in 2024, we found that that number increased to almost 1,600. So again, a very large increase over that period of time.
Yeah, it seems like it. Now, does the Upstate New York Poison Center cover all of New York except for New York City?
Yeah, our Upstate New York Poison Center covers a very large geographic footprint within New York State. So essentially, our center covers everything north of Westchester within New York State, and everything else from Westchester down is covered by the New York City Poison Center. And while we are two separate entities, we work very closely with our colleagues at the New York City Poison Center to help make sure we're providing the best care we can for everyone within New York State.
Now, what counts as self-harm, or how do you know that something is self-harm?
It's really hard for us to know, especially because we're on the other side of the phone and not seeing the patients at the bedside. So much of what we get is relying on the history of either the patient, the family, or a healthcare provider that's calling the case in. But normally, we'll count self-harm if it's told to us that the reason that the child was exposed to something was an attempt to harm themselves in one fashion or another.
Does the data show differences among genders?
It's a little bit tricky to know exactly where things are at in terms of the gender breakdown within our poison center based on the way we have our data accounted. So that part, I don't have an exact answer for now, but in general, we do tend to see that females tend to be a little bit more likely to use medication to self-harm if we look at some national data compared to males. But that being said, I don't have the exact numbers for the poison center here.
Do you know which substances are being used most frequently, if it's medications or dietary supplements? I mean, what are we talking about?
So we do tend to see a pretty consistent trend within the data that we have at the Poison Center for things that are used on a regular basis or things we get calls for. I'd say more often than not, the things that we tend to have most commonly involved in self-harm attempts tend to be things like over-the-counter medications, including acetaminophen or ibuprofen, so some of those pain medications. We do tend to see people using a lot of different other medications, including prescription medications, with things like antidepressants or antipsychotic medications. things that are oftentimes used for people who have histories of depression, anxiety, or other things that might make them more likely to have a self-harm attempt. So those are some of the biggest things that we see from a medication side. We also do tend to see people attempting self-harm with things like household cleaners. We think about things like bleach or other cleaning substances that are readily available. Those tend to be ones that are relatively common when we think about things that are used in self-harm attempts.
Are some of the exposures accidental?
So within the group of patients that we take care of, we do have a lot of different reasons for exposure. Now, typically, if someone has an indication for self-harm in our chart, it usually is not an accidental exposure, but rather one where they're intentionally trying to harm themselves. But on the other hand, within those age groups, particularly for children ages 6 to 12, as well as in that age group of 13 to 19, a number of exposures to different poisons and toxins in many cases is unintentional or accidental. We tend to see that accidental or unintentional category be the highest in young children ages 0 to 5 because they're exploring the world, trying to figure things out, and they don't know that they shouldn't put something in their mouth, right? Typically, what we see, though, if we're looking at general trends, is that as children get older and go from that 0 to 5 to 6 to 12 to 13 to 19 age range, what we typically see is that the number of unintentional or accidental exposures decreases, and the number of self-harm or intentional ingestions or self-harm attempts tends to increase. And I think that is just because as you get older, you're less likely to unintentionally get into something. And more likely, if you're exposed, it's probably for a reason of either self-harm or an intentional abuse if you're trying to use something recreationally.
So are you typically seeing that people are using prescription medications that are theirs and they're maybe taking too much, or are they taking drugs from other people?
Just to clarify that question, Amber, are you thinking more for the self-harm attempt or more for general exposures?
Well, for the self-harm, and then I have another question about self-harm too.
Regarding the self-harm attempt, we find that it really is very variable. In many cases, people will use their own medication in a self-harm attempt. And in some cases, what they'll do if they don't have access to their medications is they'll use other people's medicines or over-the-counter substances or things that they can get their hands on relatively easily.
Now, when we talk about self-harm and suicide attempts, what differentiates them? I mean, is self-harm like recreational, I want to get high and it may hurt me, or how do you define both of those, I guess?
That's a really great question and one that's a little bit complicated. But from the poison center side of things, typically we have two different categories that we think about, with self-harm being someone who's trying to intentionally harm themselves and commit suicide or cause some sort of bodily harm to themselves, as opposed to the people that are using things recreationally. We don't normally think of that as self-harm. And instead, if it's just a recreational attempt to try to get high, we categorize that into a different category for an abuse of a substance or a use of a substance rather than a self-harm.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Vincent Calleo about the troubling increase in suspected self-harm or suicidal intent among children. The national data shows a steep increase in exposures associated with self-harm after 2008, and you saw a similar increase in Upstate, and we talked about the geographic changes that happened, but even setting that aside, why do you think there's such a steep increase?
I think that there's probably not a really good single answer. I think there's a lot of things that have happened in the world that really have changed the way that people interact with other people and cope with different stressful situations. Interestingly enough, if I look at the data that we had for our poison center alone from 2000 to 2010, what we found is that the number of self-harm attempts in children 6 to 12 went from 10 to 16, and in 13 to 19 from 2000 went from, again, about 440 to rate under 700. So there was an increase in both of them. I don't think that there was quite the same degree as what we see nationally. But again, I think it just speaks to the fact that when we're thinking about poison center data, it's really important to remember that there's both local and national. And so thinking about the numbers, though, we do say they have been increasing. And while I can't say for sure, and I would certainly defer to my colleagues who are experts in mental health for children to really be the ones to have a better idea, one of the things that I think that we frequently hear is that there's been an increase in psychiatric conditions, including things like anxiety and depression, And it also seems like a lot of social media platforms kind of arose around that period of time. Now, in and of themselves, they might not be negative things when we're thinking about social media. And there are some positives in terms of connecting people. But I think if you look at things overall, as we see an increase in social media trends and some isolation from peer to peer interaction and collaboration, I think that that might be part of the reason why those things are increasing. But again, that's a little bit outside of what I'm able to say for sure from a poison center standpoint. And I'd certainly defer to my colleagues in psychiatry to be the experts to help answer that question.
Well, the data that we're talking about looks backward, and I'm wondering, is this a continuing concern in 2024 and 2025? Are we still seeing increases?
I think that while the data that we have that looks at things over the last almost a quarter of a century, we certainly have seen a very large increase from 2000 to 2024 when looking at the data that we have at our center here right now. And I'm afraid that there may be increasing numbers of cases. And that's something we as healthcare professionals really want to make sure we're doing everything we can to help treat our patients and prevent these ingestions and self-harm attempts before they occur. So it is certainly something that we have on our radar here at the Poison Center and are actively taking steps to try to help decrease exposures in the future.
I'd like to ask you about what happens when a child is exposed to medications or dietary supplements or psychoactive substances and self-harm or suicidal intent is suspected. How is this handled at the Upstate New York Poison Center? Does the call usually come from the parents at the house, or how do you find out about this?
In terms of the way that we find out, I'd say that a large majority of self-harm attempts tend to have calls that come in from a hospital setting. Because in many cases, when a family member, parent, guardian, whoever hears about one of their loved ones having a self-harm attempt, the first thing they think to do in many cases is to get them help in an emergency department, not just for the medication that they took, but also for the mental health crisis that may have led them to take the medication. So a large number of cases that we get for self-harm attempts in children do come from the hospital system or a healthcare provider. But there are also a lot of calls that we get from family members that are calling saying, hey, my child overdosed on a medication. What do I do? And if we find out that it was an intentional ingestion, one that was meant for self-harm, we typically like to make sure we say to them, you need to go to the emergency department or you need to be evaluated by a healthcare professional. Now, there are different types of risk that go along with medications, right? If someone has a self-harm attempt and they take maybe a double dose of a medicine like ibuprofen, from a medical side of things, they normally are going to do very well. But with that being said, we also get a lot more worried, not just because of the medicine they ingested, but because of the mental state that got them to that point, which is one of the biggest things that we refer them into the hospital for. I think it's really important to remember that we have to focus on treating not just the physical health of the patient, but the mental health as well. And while my job as a toxicologist or our job at the Poison Center is to help manage the overall drug problem that has caused an effect on the body, if it does, it's going to be really important to make sure that once we take care of that acute problem from the ingestion, that they have someone who's able to help them cope with the mental stress and prevent this from happening in the future.
That makes sense. Now, how is exposure different in like a 6 or 7-year-old compared with a 16-year-old?
When we think about the exposures, typically in a 6 or 7-year-old, they're kind of at that age range where they have transitioned from that 0 to 5 group where most exposures are unintentional towards the 13 to 19 age group where the majority of exposures are intentional. Now, I'd say that when you're at the 6 or 7 year range, it's probably going to be more likely to have an exposure from an unintentional source where they're still exploring the world, still trying to figure things out. Maybe they're taking some medicine because they saw their parents do it or they've gotten something before. And so it's oftentimes an unintentional exposure. But as they get older, especially if there's any history of a mental health problem, it's more common that they might start to move from that unintentional exposure to intentional exposure, where they're trying to take something to harm themselves. And so I think that's probably one of the bigger differences that we see is that, again, on those younger ends of the age range, we tend to see it being more of an unintentional exposure as children get older and they know not to take medicines that their parents haven't given them, or they know how to take things appropriately. That's when you start that intentional exposure when we get calls when they're trying to harm themselves in many cases.
This is all good information. Dr. Calleo, I thank you for making time for this interview.
Oh, of course, yes, thank you. I always just like to remind people too, Amber, that if anyone has any cases where they feel like anyone, either themselves, a loved one, may have been exposed to any toxins or any poisons, the Poison Center is always free for them, fast, free, and confidential, 24/7, 365 at that 1-800-222-1222 number. And we're always more than happy to provide any care and recommendations that we can to try to help anyone if they're going through any crisis.
Really good to know. My guest has been Dr. Vincent Calleo, an adult and pediatric emergency physician, division chief for medical toxicology, and medical director of the Upstate New York Poison Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.